The steering group were a focus group of clinicians who had a very clear sense of what we wanted to achieve early on. We recognised that staff felt more comfortable once the patient was dying. They knew what care they needed to deliver at that point. However, the bit prior to diagnosing the dying was the bit that we felt we needed to concentrate on. And we all had a clear sense of what plan of care, what point we needed to discuss.
So as a senior doctor, I think my role is to spread the word, to educate and to encourage, and to always enable my junior team and my colleagues and peers to be able to see that I'm engaged with the end-of-life message, ensuring that people are aware of what the Conversation Project is about, and to diagnose dying and to challenge. I think always challenging process and challenging people's sort of widely held beliefs, which may not be true, and trying to get people to think a little bit differently.
I think the way the Conversation Project's really helped me particularly is that even if I feel it's not a place that I'm comfortable to go to explore end-of-life care with my patients, that I have other colleagues that I can have that conversation with, and together we can help the patient find their way through. I think the challenges for me as a physio, working with people coming to the end of their lives, are that very often my role is more motivating people and getting them to face the challenge and take that extra step forward. You're often the person saying, go on, you can do it, have a go.
As a junior doctor, I think, particularly on a care of the elderly ward, we have a lot of patients that are nearing the end of their lives. We see our patients on a daily basis, and we constantly have communication both with the patients and their relatives, and dying and end-of-life care is something that we discuss on a regular basis. As junior doctors, we also have communication with the GP on discharge, and that's something that we do a lot of, discussing with GPs regarding advanced care planning and the conversations we've had whilst a patient's in hospital and the plans that we'd like to take forward into the community.
Chaplaincy has become far more involved in the multidisciplinary team working. One of the greatest achievements of the Conversation Project for us is not only a growth in confidence and acceptance by colleagues, but also our ability to be able to write into the patient notes, and particularly with respect to the sealing of treatment. We can often record conversations that we've had with patients or their families.
As a culture, we're not very good at talking about death, and I think opening it up even to professionals, it's been a bit of a hard, for some people it's been hard to start broaching conversations about end of life, but it's a natural process, and I think we all have to start taking that on board and recognising, especially with people living longer, they need to start planning for it. We plan for our pensions, but we don't actually plan for what's going to happen at the end, where we want to go. Do we want to go to a nursing home? Would we like to die at home? And as an occupational therapist, dying at home is what we try and achieve with people.